our next speakers, we have a powerhouse of people that are working in the health area throughout Aotearoa, New Zealand, and I'll introduce each of them now, and they will come up in the order I announce, which would be great. So first we have Donna Matahaere-Atariki, and Donna is currently the chair of the NGO Council. Donna has a background in education, health and social services, both at a community and a public sector level. Among many of her roles, Donna is a ministerial appointment to the University of Otago Council, chair of Te Runanga o Otago, gambling commissioner, and chair of the Dunedin-based whānau order approach, integrated health, GP, education and social services provider Te Kaika. In 2018 New Year's Honours, Donna was made a member of the New Zealand Order of Merit for her services to Māori in health. And just another little tidbit, Donna was also Junior Miss Southland some time ago, but she was Junior Miss Southland. If you could please put your hands together for Donna Matahaere-Atariki.
Ki o maunga whakahi, tēnā koutou katoa. I'm really glad to welcome you here today. Thank you, Mania, for that little personal bit at the end. It was in the 70s is all I'm telling you. But anyway, I'm just here to welcome everyone today and to talk about the fact that technology is upon us. When the council was thinking about what to have for what would be a theme, we can't get away from technology and the uses that it has. But one of the other things I'm really clear about is that technology shouldn't drive the human condition or the work that we do. Technology is a tool that helps enrich our lives and the lives of the people we work with. I think it's really important that the sector itself has some influence in the way that technology is going to be used. You'll hear, like myself, I like a good app, but I'm really aware of the inequalities that exist now and the way that technology could actually increase them or decrease them, depending on who's using that. So one of the other things I'm doing is I'm working with my iwi down south. I'm working with Ngai Tahu in developing a number of prototypes for apps in health that we intend to put out free to try and disrupt the commercialisation, if you like, of technology in health and to make that a lot more accessible to people. But anyway, we're here today, and thank you, Mania, for agreeing to be our MC, and thank you for the Minister who's gone now. But it's really important. We know we've been around long enough. Change is something that we're absolutely familiar with, and we also need to get really familiar with how we manage that change. As Mania said, we will keep reminding you about those feedback forms on your table, and we'll be collecting them during the day as well and putting more out for you. The other part about it, though, is that we've really tried to design a day and a space for you to have conversations. If you're anything like me, you come to these things for the people that you're going to catch, that you intend to catch up with, that you share ideas with, that you at times partner with in any initiative that you happen to be doing. But that's all I wanted to say at this point, so that we can ensure that we stay on time, and I guess that we're ahead of time, which we're just going to keep rolling to make sure that everybody has an opportunity to say what they want to say. But I guess one of the things I'd leave you with, which is what similar to what the Minister encouraged at the end, and I'm probably pronouncing this guy's name wrong. He was a Swedish guy, Sven Lindqvist, and he wrote a book called I think it was To Kill All the Brutes, and it was rejoinder to Joseph Conrad's Heart of Darkness. And one of the phrases in that book he wrote was, it's not knowledge we lack, but the courage to act on what we know. And I'd just like to leave that with you to ponder for the rest of the day. So, nō reira, kai te mihi, tēnā koutou katoa.
Thank you, Miss Junior Southland. And actually, in my excitement, I did not introduce the other speakers, so I will do that now, my apologies. So Keriana Brooking is the Deputy Director of Service Commissioning in the area of the Ministry of Health that manages contracts with NGOs. In her role, Keriana has championed relationships between the NGO sector and the Ministry of Health and has supported the NGO Council in their work contributing NGO perspectives as the Ministry develops policy and makes decisions regarding the health of all New Zealanders. When Keriana first stepped into the senior role in health 16 years ago, it was a DHB Planning and Funding Manager at Tairawhiti District Health Board. When primary health organisations first formed in 2002, Keriana became the CEO of Turanganui PHO. Subsequently, 6 PHOs merged and Keriana went on to become the Deputy Chief Executive Officer and General Manager of the Midlands Health Network. Homai te paki, please put your hands together for Keriana Brooking.
Yeah, well, I was junior Miss Nothing. Let's be clear about that. Tēnā koutou katoa, ngā mihi māhana, ngā mihi nunui, ko Keriana Brooking tōku ingoa, no Ngāti Kahanunu ki te Wairoa, me Ngāti Pāhau wera ahau. E mahi ana ahau ki te manatū haora, tēnā koutou, tēnā koutou, tēnā koutou katoa. Do we have any Hawke's Bay people in the house? So you can tell from my obvious good looks that I'm from Ngāti Kahanunu. We're the land of lovers, not fighters. So apologies and hellos from Jill Lane. She's helping her mama move from their family home into what I call a positively ageing village. And so that's a change for all of the whānau, and we can all appreciate that you'd want to be a part of that. So for the past 2 years, I've had the senior relationship lead for the Ministry of Health with the NGO Council. I do not speak alone when I say with any good relationship, you have to work at it. And I am proud, happy and vigilant that I work with your council members to make our relationship trusting, respectful and open. Hold on, did I mention action? No, but I can confirm that there's action in there as well. So working in any part of the health and disability system provides both risk and reward for the head and the heart and the hands. In a system so vast and complex, all people at times can feel unseen, unheard, unappreciated. The NGO Council continues to work hard on your behalf as you continue to work hard in your communities, ia rā, ake, tonu ake. I understand and appreciate your commitment and passion. And to massage the words of the late Winston Churchill, never has so much been done for so many, for so little. I wish you well for the day ahead. I'll be around for most of it. Please come and say hello. Can the Ministry of Health people please raise their hands? So if you don't know them, please also go and say hello to them also. They'd be happy to hear from you. From my perspective, your stories motivate me to continually pursue the better and the fairer. So lastly, change is about action, change is about people. So every calendar year, I adopt a new communication rule. In 2016, it was about bringing the best version of myself to work every day and to be really clear on the days that wasn't going to work for me and for everybody else. So last year, it was about replacing but with and. And trust me, it leads to more positive conversations. This year, I'm adopting this rule. Listen to understand, not just to reply. Nō reira, tēnā koutou, tēnā koutou, tēnā koutou katoa, mauri ora.
Kia ora, Keriana. What an exciting speech. Land of lovers, not fighters. That's note to self. Okay. So our next speaker, Stephen McKernan, has been Acting Director General of Health since February this year. He will remain in that role while the Ministry of Health completes the recruitment process for the new Director General. Stephen was the Director General of Health from 2006 through to 2010. During that time, he established and led a number of programs that resulted in significant gains within the health system, including improvements in child immunisation numbers, elective surgical procedure rates, and reductions in smoking rates. Stephen has worked extensively in the health sector as a consultant. He is currently a senior partner at Ernst Young in New Zealand and is taking a leave of absence from his position to carry out this role. Please put your hands together to welcome Stephen McKernan.
Kia ora whanau, tēnā tātou katoa. Thank you for those words of welcome. Conscious that I'm from the land of Ngāpuhi, so a bit of loving but a bit of fighting actually as well. But look, it's great to be here today. I certainly, in my 4 years as Director General between 2006 and 2010, enjoyed the association I had with the Health and Disability Forum, and I'd in particular like to acknowledge Donna for the work that you have done over the course of this last wee while in leading this forum, and of course the mahi and the work that you bring to Southern District Health Board in the region south of us. Kia ora. Could I also acknowledge our kamatua Mark for your welcome this morning and for setting the kaupapa of this day. I'm very pleased to see the focus that you have for this particular session today. Indeed, the opportunity that's presented by technology and the work that we do offers new hope for people who work within the health and disability sector, but critically new hope for people who are seeking to access services and healthcare in different ways. Not all is good within the technology that's being brought in. So for us as planners, as funders and providers, being able to assess, being able to judge, being able to consider what works and what doesn't is critically important. But for me, there needs to be, in some of the work that we do, a bit of a game changer to break some of the historic models that we have within the delivery system. And for me, technology offers new hope in doing that. And you will see and hear from Dr. Lance O'Sullivan after morning tea a really good example of how technology is able to improve access, how technology is able to get new services to groups and disadvantaged populations within our communities, and how technology is able to lift health outcomes for people who need services most. But for me, as providers and as funders, the movement is often seen as quite threatening, and I've already been privy to some responses in the early stage of being in the ministry to some of the work that's being done by other sectors. And as a sector, we're not necessarily as embracing of the opportunities that are presented with technology as we possibly can be. And my message to some of the funders and planners and providers who resist this is we really need to get over ourselves. If there are new offerings, new technologies, new hope of reaching populations and groups, and we're able to show the evidence and improvement in outcomes of this, then we must simply embrace that. We need funders to organise accordingly. I still look at large, what I call pots of expenditure, where outcomes and quality hasn't really shifted over many, many years. And yet we have unmet demand in so many areas of the work that we do. And we need to ask ourselves, should we be satisfied in maintaining the historic patterns of some of these investments when there are new technologies and new offerings that are starting to show promise and deliver better outcomes for people? And I would say we simply must challenge that. We can't not as we look and move to the future. So this brings me to the Ministry of Health, and conscious that I arrive at a time when we've had a ministerial advisory group appointed where we've got a mental health review being led by the Department of Internal Affairs. We have a pending review of the primary care system. We have a review of the bowel screening program happening, and all this in the space of a system that feels to me like it's been under siege and has been for quite a while, and indeed a ministry that has been under siege and has been for quite a while. So the main point for me is the only thing that matters is how we progress from today. The only thing that matters is how we respond tomorrow. So for me, then, in coming back to the ministry, there are a range of priorities that I have. I've read the PIF, the Performance Improvement Framework. I've read the recommendations from the Water Review. I've seen and looked at the government's priorities for health and what other agencies are saying about health. So the critical issue for me as a temporary Director General is what can you reasonably do in what is a relatively short period of time to respond to some of these matters, and how do we position the ministry to respond to some of those matters. So what we're doing in the ministry, and I've often talked in my last few weeks, when I was previously the Director General of Health, it's fair to say I probably put more focus on being the Director General of Health on the health system as opposed to the Chief Exec of the Ministry of Health as an entity. In coming back to the ministry, I'm pretty clear that the best role that I can play in the 3 months or so that I'm there is actually to focus more on being the Chief Exec of the ministry and to do the sensible things that are required to position the ministry so that the incoming Director General of Health can be more embracing of the opportunities that are presented by that role. So for me, what does that mean? Well, there are some critical systems and processes and work that we as a collective executive leadership team need to be more across as a single leadership cohort for the Ministry of Health. And that is about how we own the collective ministry work program. We should not leave it up to a single member of ELT who may have an area that's under siege to allow them to be challenged or fail as a leader within the ministry. We need to own the collective ministry work program. And whether we've got a hotspot in ministerial services or we're falling behind on our regulatory program or we've got an area that's struggling, it's contingent on each and every one of us as leaders within the ministry to support and focus on how we better deliver on our cross-ministry work program. So there's some short-term work that we've instituted around getting a snapshot of our whole ministry performance, better understanding how we're going against some of our core functions, whether that be our legislative roles, whether that be our regulatory role, whether that be our commissioning role, whether that be our ministerial servicing. Then there is a critical need to get across the commissioning work that Keriana is leading. We commission $3 billion worth of vote health expenditure every single year. It's a large and complex area, and it hasn't kept pace with some of the other areas that have received funding in the health system over the last 7 or 8 years. So there's a critical need in that. And then for me, there's a critical need in understanding the overall performance of the sector, and in particular I'll name the district health boards, because of a concern for government has to be the level of deficit that is occurring within district health boards. In 1 week I had a call from 4 district health boards to say that their deficits had all worsened. And there was $25 million of red ink that had worsened in that period of time. So this escalation of deficits, and importantly, what is the ministry's response, and understanding that, and understanding what the drivers of these deficit positions are. This is crucially important, because unless we get that under control, there will be no more money for other parts of the system. There will be no more money to deliver on key priorities and aspirations that government has. So for me, there were a couple of early priorities within the ministry. The other thing that we're doing, and it was a pledge that I gave to Peter Hughes, who contacted me, the State Services Commissioner, to see if I would be willing, this was just prior to Christmas, to come to the ministry and be involved in a temporary capacity. And after responding and saying, well, why me? You know, you're going to upset my life. 8 years has been a long time. I'm not sure I can, and I still live in Auckland, and so on. But anyway, on reflecting on it, I said, yes, absolutely, I would. But the one of the conversations I had with Peter was, what can you reasonably do in 3 to 4 months? So we talked about the fact that chief execs often reorganise a little, and historically I've been known for doing a little bit of that. And I said, look, this is not my place. What I will do is do everything I can to give the new Director General, in essence, maximum freedom to either bring on new capacity or capability if they think they need that in critical areas. What I said I would focus on is primarily how the ministry works. And so therefore not to reorganise, but to ensure we have the capacity in some of our key areas, and in particular, perhaps a new way of working to look to be more embracing and deliver on government priorities. So at last week's staff forums, I talked to the staff in the ministry about a number of things. One was a short-term piece of work, but the other was how we're going to respond to the PIF, to the water inquiry and some of these other reports, and how we use that to embrace a different way of working within the Ministry of Health. And unashamedly, we said we're going to focus on 4 major flagship programs of work within the Ministry of Health. And the first one of those programs is a concerted focus and a new look at what needs to happen to address health inequalities. The second piece of program was mental health, and both preparing to support the work of the independent review, but also to better prepare in a cross-ministry way and reassess our own mental health capacity to both work with the sector and to respond to the findings of the review. The third piece is around primary care, and again, the government has signalled an intention to review some of the constructs of the current primary care system, announcements around funding and contracting as a program to be looked at. More recent discussions that the Minister has signalled have been more about a broader review of primary care in general. So ensuring the ministry, along with the sector, is able to respond to that, another key program of work. And the fourth program of work is around child wellbeing. In order to be able to bring the work, the cross-government work being done around child poverty, but to bring this into a child wellbeing focus. So for me, this is a test for the ministry. That can we truly organise ourselves to embrace these major programs of work? Can we use these programs of work to get appropriate sector expertise and engagement in these work programs, and be very clear that these programs of work will have the first call on ministry resourcing as we look to set our budgets and train between now and June for our work program beyond July. So for me, those programs of work are also key in order to be able to reset or to reinforce how the ministry is going to engage and work with the health sector more generally now and into the future. So there are some comments. I guess the third piece of work that I think is critically important. So a short-term piece around performance and understanding how we're going against our core business. A second piece around what are some of our big strategic response areas and how can we as a ministry work in a cross-ministry way to develop roadmaps and plans and actions against it. The third piece for me is being able to work with the Ministerial Advisory Group. Here we have a group that's been established with a very broad and permissive terms of reference. And I guess, as someone who's been in the health sector a long time, this is the government who established the model that we have today. So if there are to be any tweaks and changes to the model moving forward, then I would anticipate the Ministerial Advisory Group would be very keen to hear what they look like. They have some of their own thoughts, but they're embarking on a process of some engagement with the broader sector. And so for me, the third piece of work is a bit of a challenge around how is the New Zealand health and disability system currently performing? What's working well? What's not working in an optimal manner? Are the decision rights that sit within the system, are they optimal? Do we have the right sort of decision making occurring at the national level, at the regional level, at the local level? Where does some of this need to change? Do we really have an understanding of some of our big areas of expenditure and investment? And what are the outcomes that we're getting for that? And how do they compare with like investments in other jurisdictions? We should know all this information in order to be able to inform what needs to change in the model moving forward. So for me, you're not going to get across all of that in 3 or 4 months, but actually to set a framework that work can continue and that some of that thinking can occur both within the ministry and more broadly, for me is critically important. And the time is right for that sort of thinking right now. So there's some opening comments. Lovely to be here and great to see that the NGO Forum is so strong and has gone from strength to strength over the course of the last decade. Go well in the work that you do, and I look forward to catching up with some of you over the break. Kia ora.
Thank you, Stephen. Thank you for outlining your 3 key priority areas, and also to the Ministry of Health, to you, Stephen, Keriana, and to your staff that are here. Thank you for your investment in the NGO Forum. Right, now we've got 10 minutes above schedule, which is unfamiliar territory for me. So I have actually decided to go a bit rogue. So can I please invite up the NGO Council members so you can meet all of your hosts. You've already met Donna, Matahaere-Atariki. So if I could ask the other members of the NGO to pop up and introduce yourselves. And here they come. So just while they're gathering to the stage, we will have morning tea at 10:30. We'll be back here sharp at 11 a.m. Now there's going to be an exhibition table outside, and that will be running that table will be Mark Powell from the Ministry of Health, and Mark is working in the pay equity area and is happy to chat with you. So that's what the exhibition table will be. So please feel free to pop up and say hi to Mark. The council seem a bit nervous, don't they? But here we go. And first one up, if you'd like to come up, Salah.
Good morning and tārwhalava everyone. My name is Silau Vaisola, based in Auckland. I am the Chief Executive of a primary health care provider and also a social service provider based in Otara. And this is my first term as a rep for the Pacific area for the NGO Council. Malo.
Don't be shy.
Kia ora tātou. My name is Warren Lindberg. I'm the Chief Executive of the Public Health Association of New Zealand and Deputy Chair of the NGO Council. I've had a long career in public health. I was very pleased to see that Stephen McKernan was brought back as DG for a short period of time, and look forward to working with him and the Ministry for quite a long time yet. Kia ora.
Talofa Lavan, good morning. My name is Pesio Ahoni. I'm currently the National Director of Mapumaya Services, which is the Pacifica unit of the Problem Gambling Foundation of New Zealand. I run a team in Auckland, Wellington and Christchurch looking after problem gambling addictions and coexisting issues, as well as public health team. I am one of 2 Pacific reps on the NGO Council, and I think this may be my second term. I'm not 100% sure, I've lost track. But very warm Pacifica welcome to you all this morning, and I hope to get around the room and meet as many people as I can. Whiwhite lava.
Tēnā koutou katoa, Kate Mida Vulture, 100,000 welcomes. My name is Maurice McGee and I'm the Chief Executive of Community Living. We support people with intellectual disability to live their dreams through community connections. And I'm from Hamilton. I am one of 2 disability reps, and this is my first year, and we're delighted to be here and to welcome you all. Kia ora.
Good morning, I'm Sonia Thursby. I'm the Chief Executive of the Yes Disability Resource Centre in Auckland, and I'm also a member on the Executive of the New Zealand Federation of Information Centres. So I am the second disability rep on the council, and this is my first term, and I can tell you it's a very steep learning curve. So I'm catching up. Thanks.
Kia ora, I'd like to introduce you to my colleague here, Catherine Marshall, who is unable to be here but sends her regards, and my other colleague here, Carol Koha, who is currently unable to be here. So, and my name's Marion, and I'm the CEO of the Platform Trust, and I'm representing the mental health and addiction sector, and I'm a recycled member of this. I was on the very original NGO Council, and to think that it could have grown to this is unbelievable. So yeah, that's me.
Kia ora tātou, ko Barbara Disley tuku whenua. I'm the Chief Executive of Emerge Aotearoa. I'm one of the mental health reps on the NGO Council. And Emerge Aotearoa provide mental health, drug and alcohol, social housing and disability services nationally. And I'm also going to be talking to you a little bit later about the mental health inquiry, which I know you're all desperately keen to have a voice in. So I'll talk to you about that. So it's great to be here, and this is my first term, coming to the end of my first term as an NGO Council representative. So kia ora tātou.
Morena koutou, ko Beverly te hui ahau, no Pakipaki ahau, engari, kei oe marama ahau e noho ana. My name's Beverly Tahuya, I come from Kahungunu. I trained as a midwife 20 years ago and was born into healthcare. When I say that, my mum started Kahungunu Health Services, a Māori provider, back in the approximately the early 90s, and so it chose me, I didn't choose it. Since then, I have continued with research and am here as one of our representations in Māori Health. Kia ora koutou.
E te hui tēnā koutou, e tikana ka tuake au ki te mihi atu ki a koutou rā. Huru noa te ruma mō koutou mahi, e mahi ai koutou, hora atu i te motu, nō reira, tēnā koutou, kia ora hui mai tātou. Ko Trevor Simpson tōku ingoa, I'm the Deputy Executive Director for the Health Promotion Forum of New Zealand. My honour to be part of the NGO Council. I'm here as one of the public health representatives, along with Warren, and just glad to be part and parcel of this group that's doing some awesome stuff around the country. So it's incumbent on me to be supportive as I can be to everybody, not just in the council, but everybody in this room who's doing some wonderful work. Some of you would have seen, I'm just going to have a plug, is that all right? Some of you would have received some of the mud packs that we've been handing out this morning. Just a plug for our organisation, the Health Promotion Forum, along with the global umbrella organisation for health promotion, the IUHPE, bringing the World Conference here to Rotorua next year in April. First time it's ever been here. It's going to be probably one of the biggest health conferences ever held in Aotearoa, New Zealand. I'm just going to give a plug so that you go online and register, even if you don't know that you're going to be going, and you'll receive information as the conference picks up steam and arrives here in April next year. So please don't miss out on this opportunity. There's some wonderful global speakers coming over to participate in this conference, as well as some really good Aotearoa, New Zealand representative speakers as well. So just a plug there. Thanks very much. Kia ora tātou, ko riro mai te honore, kuro te ahau ki te tuku nā whakamoemuti ki tō tātou kaihana mō nā kai tuara tēnei rūma. Nō reira, i tikana ka tuku atu nā whakamoemuti ki aia, kia tauona manaakitana, kia ki hoki te puku, kia ki hoki anō te nākau, nō reira, kia ora tātou. E whakamoemuti ana mātou mo enei kai, e homai nei, haur no mātou tinana, whanaia hoki o mātou wairua ki te taro o te ora, ku ukaraiti hoki tō mātou ariki āmine. Kia ora tātou. Kai next door, there's some gluten-free and vegetarian food available out there as well. You'll have to probably go and find it. Kia ora, thank you.